What muscle weakness symptoms indicate MD? Muscular dystrophy is a group of genetic disorders that cause progressive muscle weakness. Understanding the symptoms can help in early diagnosis and treatment. So, what muscle weakness symptoms should you look for? One of the first signs is difficulty walking. This might show up as a waddling gait or even toe walking. If you notice someone frequently falling, it could be due to muscle weakness and balance issues. Children may struggle with running, jumping, or climbing stairs, which indicates weakened leg and hip muscles. Another important symptom is difficulty rising from a sitting or lying position. This often points to weakness in the hip and thigh muscles. In children, delayed motor milestones, like late walking or crawling, can also be an early indicator. Muscle stiffness and pain may accompany these weaknesses. Some individuals may experience muscle enlargement, known as pseudohypertrophy, particularly in the calf muscles, which is common in Duchenne muscular dystrophy. The weakness can affect specific muscle groups. It may be proximal, meaning closer to the trunk, like the shoulders and hips, or distal, affecting the hands and feet. This weakness can be symmetric, affecting both sides equally, or asymmetric, where one side is more affected than the other. Abnormal gait patterns, such as a Trendelenburg gait, can occur due to weakness in the hip stabilizers. In later stages, muscle atrophy or wasting may happen, along with contractures, which are permanent muscle shortenings. Fine motor tasks can become challenging if the distal muscles are involved. Additional symptoms often seen with muscular dystrophy include muscle tightness, joint stiffness, and sometimes learning or behavioral challenges, especially in Duchenne muscular dystrophy. Muscle weakness in muscular dystrophy is typically progressive, meaning it worsens over time. The pattern of weakness helps healthcare professionals identify the specific type of muscular dystrophy. For instance, Duchenne muscular dystrophy usually starts in early childhood with proximal muscle weakness and calf pseudohypertrophy. Becker muscular dystrophy has a similar but milder progression. Limb-girdle muscular dystrophies often affect the muscles around the hips and shoulders. Facioscapulohumeral muscular dystrophy can cause asymmetric weakness in the face, shoulder blades, and upper arms. Diagnosis involves a clinical examination focusing on muscle strength patterns, physical signs like scapular winging or contractures, and supportive tests such as genetic testing, blood tests, electromyography, and muscle biopsy. In summary, muscle weakness symptoms indicating muscular dystrophy include difficulty with walking, running, climbing, rising from positions, frequent falls, muscle stiffness, and specific patterns of muscle involvement that vary by type. Recognizing these signs early is crucial for effective diagnosis and management. Always consult healthcare professionals for personalized advice and assessment.